Hello viewers, childhood obesity or adolescence obesity is a major problem of urban population. We don't get to see even this childhood or adolescence obesity in rural areas. Why is this happening? What are the causes for childhood obesity? Primarily, there are three causes. First one is genetic. Second one is their lifestyle. And the third one, there are certain medical conditions which can lead to childhood or adolescence obesity. Now we are talking about childhood, say from the birth till about 8 to 10 years of age. Then adolescence obesity, say after age of 10 to 15 or until the child gets matured enough or he or she attains puberty. Now we are talking about genetic obesity in children. What actually goes wrong? Now they have their abnormal DNA pattern which runs in their families. Now this is something called as autosomal dominant. Autosomal dominant means there is some abnormality which has gone to the further generation, or many times it so happens is it skips that further generation and goes to the following generation. So if the grandparents are obese, the parent may not be obese of the child who is already obese. So this is what actually happens is in genetic obesity. Now there are different syndromes which are named, like one is Bardet-Biedl, that is BB syndrome. One is Prader-Willi syndrome. These abnormal genes work on the hormones of the children. They make them more hungry, more affectionate to calorie-dense food. And that is how they start eating what we call as hypophagia. And whatever calories which are consumed by these children, it gets equally and 100% absorbed in their body. So it goes straight to their fat content, which becomes excessively in high amount, and it gets deposited in their adipose tissues. Genetic obesity in children, we talked about. And now if you have somebody who's suffering with genetic obesity, how are we going to manage the patient? We have to get them investigated properly. We have to do all the genetic mapping and then understand what syndrome is this patient suffering from, and then form a line of treatment. If you ask us, there is no gene therapy anywhere in the world. So we cannot change their genes. It's their bad luck that they have come with those abnormal genes which are inherited by them, by their all the family tree before them. Now these genes, what we have seen, they work on children's hormones. We can do something by surgery on those hormones. So in bariatric surgeries, we alter the hormonal pattern or the places where those hormones are produced, we take them out so that bad effect of genes on their hormones can be lessened down, and that is how the children can get a complete permanent treatment. But still, they have to follow a strict follow-ups for not to regain the weight back. Childhood obesity or adolescence obesity by a different cause, which is most commonest, is lifestyle. Now the children, they are not obese alone. No child is obese alone. Why? Because there is a lot of external factors which work on their obesity, which makes them obese. Now, especially it starts with their home. If at home, if there is obesity, or if there is no good conscious understanding about what our children are eating, it starts from there. Let's take it to the second one is their home, because these are the two places where children remain and spend most of the time, in schools and home. Now, any one of this is, if it's bad in consideration of obese, anti-obese diet, then children can have obesity. So that's why the people should be careful at home as well as their schools. Now, the second reason, the commonest reason, these children are too much stressed today, especially in these urban cities, for the numbers. They should get the highest marks. So they study more and more. They spend more and more time in schools and the tuition classes. So they do not have time for their exercise. And they're continuously stressed, and that's why they become obese. Now, third is, there is lack of open spaces for the children to play. If at all, if they find some time out of their busy curricular studies, they don't have good enough spaces for the physical exercise. That is the commonest thing which happens. Fourth is the nuclear family status of urban population. Nuclear family is husband, wife, and the child. Now, both the parents are working. They do not have much time to give it to their own child. So the children are left with their diet and with their day-to-day lifestyle on their own. Both parents are gone out for their jobs, and then they are left with all the maybe for fast food or any junk food for the child to grow up. It's very easy to call for a junk food than make a good healthy meal. And no child would want to cook their own meal. So these are a few things which contribute to obesity, and they contribute in the lifestyle disease.
Subscribe to my channel and click on the bell icon to get notification of all my videos on overcoming obesity. Live now, live healthy, only with Sushruta.